Hi, everybody. Okay, here is my tips for knees. So between being a trainer and helping out clients with knee issues, I have my own knee issues. I have my own knee injuries, including when I was teaching high fit about 3 years ago. It was 3 years ago when I was teaching, and I chipped a piece of my kneecap clean off just from doing a jump, just because of how just the structure of my knee and the issues that I already have with it. So I was surprised to find out when I went to physical therapy that part of my issue was weak glutes, which seemed pretty crazy to me considering that I was teaching a butts and guts class. I've been teaching Pilates forever. Thought I had really strong glutes. So one of the things to consider when you have issues from your knee is what's happening either below the knee or above. When you have weak glutes, this travels down to your knee. So just consider working with the trainer or working with the physical therapist to see where any other muscle instability and imbalances are happening. So get that checked out and start strengthening those areas. Number 2, if you're really tight through your hamstrings and your calves, it pulls on your knee, right? That's just going to happen. So I would highly recommend foam rolling. There are methods out there. There's different methods, but my favorite method is the fasciator. It's a really hard roller, but that gets into your deeper fascia. When you have a softer foam roller, that's really just connecting to your nervous system, which is good too. And that deals with some different pain in a different way with the nervous system. I work with chronic pain and clients and specialize in nervous system disorders just because I have MS myself. So I get working with pain signals and things like that. And then firing up. So the other thing that can happen though is when you have tight Achilles, tight calves, tight hamstrings, and it pulling on the knee, we've really got to be rolling out on a schedule. And I should take my own advice and do it more. We get busy, right? And we just don't put it at a priority. So guess what? They get tight. Tight muscles are literally tight muscles around nerves, and you're going to get pain from that. So roll out. Your fascia is connecting all your muscles, all your organs, and it's kind of like taffy. Where we've talked about it being netting before, it's actually more like taffy, where it's got this give and pull, right? And if you're not rolling out so that it's got more give to it, it's going to stay tight. And it also requires you drinking a lot more water. So get into a rolling program. If you want to talk to me more about what that looks like and about some exercises for that, you can message me. I do online consulting as well. Because I deal with pain, you guys. I'm not teaching tonight because I have just nerve pain right now. So I get it, I guess. So see a doctor, physical therapist. Make sure you don't have any muscle imbalances that you need to work on. 2, foam rolling and getting that fascia worked out. 3, stability. Do you need to be wearing a knee brace? Do you need to be wearing an ankle brace? Just to give it a little bit of extra support. Instructors need to modify as well. So make sure you are smartly doing these exercises, especially when we're talking about high fitness. Are we rolling toe ball hill? Are we looking at where our knees are supposed to be directed? If you're landing in a compromised position, meaning that you're landing and knees are going separate from where your feet are landing, or twisting, okay, we need to be looking at how you're picking up your feet, how you're moving, how you're rotating, how you're turning. I often see, and I've done a video on this before, I've often seen how we stay jumping, even doing jacks on the balls of our feet. That's going to tighten up your calves and, right, pull on the knee eventually, right? And then you're going to have feet issues on top of that. So really look at form, look into how you're landing those squats. Position of the spine is another big thing. And you have to remember that the core itself is your stability. If we don't have stability happening through there, that again is going to travel down into the knees. So, and as far as arthritis goes and the pain associated with that, fascia going to be a big deal, right? Those pain signals happening with that, taking your vitamins and your glycosamine and keeping those joints really kind of lubed out from taking those vitamins, and inflammation, right? Inflammation adds to arthritis. Where is inflammation found? Right? Diet. Foods that have inflammation in it. So you want to look at higher antioxidant foods, and make sure you're staying away from things that are going to cause inflammation, and get on vitamins that take down inflammation. I just recently went keto because guess what? Takes down inflammation, and it has helped. So it's, when you're talking about joints and things like that, smaller movement is key. So while we are teaching this big movement and these high fitness movements, if you don't have things like Pilates and yoga and gentle weight bearing, things to keep your muscles moving in a different way other than high impact, you are going to feel the weight of that. And your risk for injury goes up when you are not cross training with something that's going to keep your muscles healthier, because Pilates and yoga and lighter movement develops muscles closer into your joints, and then you're working on the body from the inside out. So focusing on, that's why I love Pilates so much, you guys. It has saved my life for real. Because like I said, the risk for injury goes down like 80%. 80. It's a high number. So working from clients from young to older, same idea. That was 7 minutes long, you guys. Speed it up if you need to. I'm going to put it on the YouTube link so you can speed it up. But if you have questions, message me.